the past 24 hours been like? How many patients have you seen? How many are still here at the hospital?
We evaluated 22 patients from the accident in Madison, Connecticut. We received a number of them from the scene, and then a further wave of transfers from facilities on the shoreline later in the evening. 4 of those patients are critical. The remainder are non-critical, but most are still in the hospital.
Dr. Davis, has this influx of patients affected how the hospital operates? I mean, New Haven's a very busy city. It's a big hospital that gets a lot of patients every day.
So this is what Yale New Haven Hospital's Level 1 Trauma Center does. We can flex up for major catastrophes and maintain regular operations. Our operating rooms are running at full capacity today. We did shut down briefly yesterday in anticipation of the influx of patients, but resumed normal operations fairly quickly.
Talk about the types of injuries that you saw yesterday that you typically will see in a crash like this.
A number of the injuries were thoracic or chest, rib fractures, lung injuries, things like that. Obviously a number of bone fractures, and a couple of more critical vascular injuries and things along those lines.
When you talk about critical, would you characterize them as life-threatening? Are they, are these life-threatening injuries?
So at the time that they occurred, they were life-threatening. The patients have been treated and are currently just in critical, but not in grave danger at this point.
And when those injuries, what were they and how were you able to?
I'm not able to give you that information.
Can you characterize how serious? I know you said lung punctures. Is that something that would be critical?
A number of the patients were actively bleeding and required transfusion. A number of patients required procedures to stabilize them, but that's the extent of the details that I can give you.
When you look at the accident that occurred yesterday, the fact that this bus that was full of people is like tossed on its side, no one died, and you're saying that no one is gravely injured. How do you think that came to be that no one was so seriously hurt that they lost their life? And is that a good thing? How do you feel about that?
Well, obviously we're not fond of having people lose their lives. So yes, I think it's a good thing that nobody lost their life. Having not been at the scene, having not witnessed the accident, I can't comment on how they survived. Other than I think a number of people were very fortunate. There were a number of walking wounded.
Dr. Davis, was there any communication difficulty with any of the patients, given that many of them are of Asian descent?
There are a number of patients that do not speak any English. We've been relying very heavily on our interpreter services.
Dr. Davis, we understand that a lot of people were admitted to the hospital. How long do you think those people will, can you give a ballpark on how long those people might remain in the hospital?
I think it depends on how they do. Some will likely go home today. Others will remain for more extended periods of time. It all depends on their clinical condition in the next couple of days.
There are 4 that are critical. How many other patients remain in your care?
I know we evaluated 22. I know I just rounded on about 10 or 15. So we have a fair number of patients still in-house.
What were the decisions about the 3 different? It was Yale here, it was the one in Guilford, then it was the Shoreline Clinic in Westbrook. Sort of why those 3 different places?
I can't answer that. You'll have to ask whomever was triaging on the scene.
There has been some debate on whether or not there were seatbelts on this bus. I know you're not there. I know you don't know this bus company or whether they had seatbelts, but I'm sure you've seen a lot of car accidents before and seatbelts were used or not used. Would you say that these injuries are indicative of somebody not having a seatbelt on?
I can't comment on that.
Thank you, Dr. Davis.
Thanks a lot.
Thank you.